Okay, I think we'll go ahead and start. It's 7 o'clock Central Time, so we're going to go ahead and start. We'll eventually get people to trickle in here. Again, my name is Dr. Chad Tattini. I'm the chair for the Young Aesthetic Plastic Surgeons Committee. We have been doing the live journal club's nation editors. So welcome to the December live journal club. And we had a fair amount of people sign up today, so we're excited that hopefully more people will trickle in, and we'll proceed with the discussion over the next 30 to 45 minutes. Thank you, Kylie, for sitting in for Hunter, helping us do this every month. Today we got a wonderful, wonderful article and authors and moderator tonight. We're reviewing the article, The Role of Pornography, Physical Symptoms in Appearance and Labiaplasty Interest. It's a wonderful article, brings up a lot of good points. I'm excited to hear what people have to say. The authors of the article were Sorice-Virk, Alexander Lee, Francisco Canales, and Heather Furnas, two of which are present tonight. We're blessed with Dr. Canales and Dr. Furnas. Thank you so much for spending your night tonight with us. And then Dr. Christine Hamori, who's the moderator as well. And we'll have the authors present first for the first 5 to 10 minutes. And Christine will take over for 5 to 10 minutes after that. And then we'll open it up for discussion. I highly encourage everyone who's on board tonight to either raise their hand or participate in the live group chat session. Again, this is a live discussion. We want to get a lively discussion, so feel free to get a discussion going on, and Dr. Hamori will kind of coordinate things. I should mention that no one has any relevant disclosures tonight. And again, this will be about a 30 to 45 minute overview, which is recorded, by the way, by Radar. So you can watch this anytime in the future as well. So without taking any more time of anyone else's time, Dr. Furnas, Dr. Canales, I'm going to hand it over to you guys.
Thank you.
Great. Thank you so much, Dr. Tattini. It's a real pleasure to be here. To give sort of an overview of our article, over the years, we've been seeing more and more labiaplasty patients coming in, which correlates exactly with the ASAP statistics that show that the numbers increased from about 2,000 in 2011 and is reached almost 13,000 by 2018. So women were certainly more interested in labiaplasty. And at the same time, we would see more and more articles, both in the professional realm as well as in the lay media, stating that pornography was a driving force for these women seeking labiaplasty. And yet that was not what we were finding. And so we decided to take a look rather than to assume that that women were actually not being motivated by pornography. So we did a study of our patients, and we looked at patients who were having 124 consecutive patients who were having labiaplasty, and then we also looked at a control of 50 women who were not interested in labiaplasty but who were interested in aesthetic procedures. And we asked them about 11 different types of symptoms, as well as asking them, did pornography influence your decision to have labiaplasty? And so we did confirm, in fact, that labiaplasty was motivated primarily by physical symptoms and appearance-related symptoms. Pornography did influence 11% of patients, but that was nothing compared with the other symptoms that a third or more of patients experienced. For example, over half experienced twisting of their labia, feeling uncomfortable, tugging of their labia, feeling less attractive, having a negative impact on self-esteem, negative impact on intimacy, half said that it limited their clothing choice, and a third said that their labia were exposed in bathing suits. Interestingly, among the controls, 4% said that they were influenced by pornography to have labiaplasty, even though they were not among our labiaplasty patients. And a small percentage were actually symptomatic themselves, although they were not considering labiaplasty. And so and this was not statistically significant, the difference in pornography influence among the labiaplasty patients compared with the non-labiaplasty patients. So in summary, we found that pornography motivated a very small percentage of our patients, and it was certainly, the influence was certainly dwarfed by the other symptoms, the other reasons that women were seeking labiaplasty. And that was sort of our finding.
Okay, Chad, you want me to take over?
Yes, please.
Okay, good. So I think it's a wonderful paper. Heather and Paco, thank you so much for getting another publication there in the literature in labiaplasty, because we so desperately need papers. Why do you think that it's a difficult topic for us to publish articles about, and why is the lay community so confused about the reason women want to pursue these surgeries?
Well, I think actually, Dr. Canales, if you want to chime in.
Well, I think that as in any topic, they say that if you don't have data, you're just another person with an opinion. So part of the motivation of this article was to get the data that is not there. There are a lot of assumptions in the lay press, in the professional media, in our meetings, that because pornography viewing is up, and at the same time labiaplasty requests are up, that the two are correlated. But we all know that correlation does not mean causation. So we wanted to investigate that. They say that eating ice cream goes up, and at the same time drowning deaths go up, and one did not cause the other. It just happens that both of those things happen during the summer because the temperature is up and people eat ice cream and people go swimming and are more prone to drowning. So our study wanted to find out, is there a correlation or a causation between pornography viewing and labiaplasty seekers? And we found that it didn't, and we'll elaborate on the data a little bit more. So the best way to find out was to actually ask women why they saw labiaplasty, and that's the findings of our study.
And do you think that the reason women were seeking labiaplasty is more based on symptomatology, or the fact that they are self-conscious and concerned with appearance?
It's actually a combination. If we look at the numbers, there were very few women who only stated appearance was their concern, and just as there were very few who only stated that functionality was their concern. So I think if we look at labiaplasty concerns across the gamut, we actually, the more questions the better we understand, the more questions we can ask. We did not ask questions about hygiene or retention of urine. Some people retain urine in the folds of their labia, or malodor. There are a number of other symptoms that we did not hit upon. And so the better we understand this, the more questions we can ask. I think we will find that it is not just a single issue reason motivating women. Certainly there are a subset who will be interested solely by appearance, but at least in our practice, we find that functionality plays a strong role as well.
Okay, and I think some of the pitfalls with research in the general area is just the fact that we don't have a lot of standardized questionnaires. So it's difficult to come up with questions that you can kind of predict the answers will help solve some of these issues that we have. And for instance, I know you're asking questions about pornography. Did you define pornography for the patients in the questionnaire at all?
We did not, and we didn't ask of those motivated were they looking at pornography just to see what other women's genitals look like, or were
Yes.
they looking for erotic reasons and then thought, I want to look like that? So there are many questions that we actually did not address, and there are many more aspects that could be addressed. But it's an early study, and it's the largest to date. So it's sort of a baby step in our understanding of the broader picture of why women seek labiaplasty.
Yeah, because I do think it's important for people to understand the difference between pornography viewing and viewing of naked genital images. I mean, I think all women that undergo labiaplasty have probably seen naked genital images, and you have to be careful that is that going to be pornography? Not necessarily when you're looking at before and after labiaplasties on real self. So I think maybe as we move on and do more of these, we can kind of filter out that difference, because I think almost all of them have seen photos of nude women, but the question is, how do we, is it pornography? And I think the media wants to say that it's pornography. ACOG wants to say, oh, it's pornography, but I think people are just curious, looking, and some media influence from pornography. But I mean, this paper, as you said, basically it downplays that, which is great.
Exactly. Really, and if you think about it, if you are a woman interested in a breast augmentation, it's very easy to see breasts or tummy tuck or liposuction. There, just about every other part of the body is easily viewed other than the female genitalia. And so women have two options. They can look at before and after photos on doctors' websites, or they can look at pornography. And and basically anything that shows genitalia is going to be termed pornography.
True. Yep.
And I think early on when we put before and after photos on our website, some people were offended. And that was probably about 10 years ago. And now it's accepted. And I think that because people are looking at it from a very clinical standpoint, it is helpful because the result might be.
Yeah. And I think the options, when you were questioning the patients about whether they viewed pornography or not, it was basically yes, and it influenced you, no, it didn't influence me, and yes, but it didn't influence me. So you have to wonder whether if you gave more wiggle room to yes, but it didn't really influence me, or, I saw naked genital images and that influenced me. It's just we need a questionnaire for it that would be more standardized, because basically, I think when you ask a patient, do you view pornography? How many people are going to say yes? You're spooked. Write that down. Who's going to see it? So we have to figure out a way to say it, but you want to inquire about it. We have to, because these people are making rules. ACOG is making a stance that people are doing it for pornography. So we have to define that term.
Now, interestingly, we did ask separately, do you view pornography? And our numbers, both with the control and the labiaplasty patients, did reflect the general population, which told us that our numbers were probably not too different from what a validated study would have shown.
True. Now, do you think that this paper will help dispel prejudice against these procedures?
That is our hope. First, we hope that we define the reasons why women seek labiaplasty, why women interested in labiaplasty might want to view pornography for reasons other than watching with their boyfriend or something, that there might actually be an anatomic interest. There's a lot of judgment against pornography, and because it's associated with violence against women, objectification of women, addiction, and so when we say that pornography is a driving force in labiaplasty, it really demeans the procedure. It sort of makes it seem like it's done for a frivolous reason, that women have no agency. And so the more we dispel that reason as a primary motivating force, I think the more accepted and the more seriously we will take the rationale for women seeking labiaplasty, and the more we can accept that it truly impacts and improves a woman's quality of life.
Okay. So you guys found about 90% of labiaplasty patients did the surgery because they felt self-conscious. Why do you think why do you think that's the case? Why are they self-conscious? And how do they realize they're self-conscious?
Well, in our experience, a lot of them have just not liked the look that they see. It's not that they're trying to look prepubescent. They just don't like seeing sort of the lumpy, dark, rough pigment in between their legs. Some of them say that they're tired of tucking them in. The labia fall out of their underwear. They can't wear thongs. They fall out of their bathing suits. So it's more than the sort of media image that they want to look like a clamshell. That they want to look prepubescent.
And how about having no hair? Do you think that's influencing anything?
It probably does have an influence, but a number of my patients come in with hair and with the same complaints.
Wow. Okay. Because in other procedures, we find if someone's self-conscious, let's say about their breast, usually they've seen an idealized image, and then maybe they've had a negative comment from someone, or something in their head kind of clicks, or they have a personality. How much do you see negative comments playing into patients that seek labiaplasty?
We see a fair amount of that, and it is actually interesting to hear the comments. And we recently had a very well-educated professional woman who was in a relationship, and she was in her 40s. She'd been divorced, and she said that when they broke up, the boyfriend said to her, "You're really broken and messed up down there." And that completely shook her, and all of her self-confidence and all the professional degrees went out the window, and all she could think is, "I'm never going to be in a relationship again." She had a very modest amount of excess in the labia minora, but it was a comment that prompted her to seek treatment. And it was a very simple procedure. She said, "I'm never going to think about this again. It looks great." And that was it. And she never came back.
True.
Yeah, and we've seen both where the husband or significant other doesn't care. And there was one young woman who said that her ex-boyfriend said she looked like scrambled eggs and beef pats or beef flaps or something. Yeah. And she said that she just stopped having sex except when she was drunk because of those comments. And then after surgery, she said it transformed her life, completely transformed her life.
I agree. And for people that don't do these labiaplasties, I always tell people that the people are as happy as a breast reduction. They're the kind of patient that hugs you after you do the surgery because you really changed their life. And I do think it's important that we all, do more research on this procedure and continue to lead the way. And not even just in labiaplasty, but also other vulvovaginal treatments. Heather, what other treatments do you do besides labiaplasty surgically?
Well, we do majoroplasty, vaginoplasty, perineoplasty, monsplasty, mons liposuction.
Yeah, we have to do more papers on these other parts too.
Exactly. Yeah, because labiaplasty is, the most popular, but we do need more. There, very little has been written on some of the other procedures. So you're absolutely right, Christine.
Yeah. Yeah, and maybe with the help of some of our Australian colleagues that are working a lot on these validated questionnaires, Gemma Sharp, maybe we can come up with some, good scales that we can use, that we can standardize. Because I too use some ad hoc questionnaires when I'm asking patients about the procedures to try to review it, and it's so difficult to compare them. And we have to kind of get together and make a solid validated questionnaire to study these areas. I think it's important.
Yeah. Gemma Sharp is a great contributor, and you're absolutely right, because I think these non-validated studies are a step towards collecting data to establish better validated studies.
Yep. Good. All right. Dr. Tattini, do we have any questions from the audience?
I have a question,
Okay.
actually. Has ACOG ever done a similar study like this? And if so, what were their findings? Any idea?
You know, the ACOG has come out with a stance in 2007. They have not, to my knowledge, established the data to support the lack of safety and lack of efficacy. Certainly, there have been a number of studies showing that the patient satisfaction rate is 90% or higher, and complication rates are low. But they reaffirmed their statement this year, stating that it was still untenable to perform these procedures.
Yeah, we actually got an email a year ago from an obstetrician gynecologist who had referred patients to us for over 20 years. And he said, Heather and Paco, it has come to my attention procedures on women, including all the labiaplasty, vaginoplasty, and perineoplasty. And he wanted to warn us that a labiaplasty was strictly a psychological procedure, and that we were performing these procedures for our own financial gain only, that he would never refer us another patient, and that he was glad he didn't have that, quote, stain on his medical career like we did. So they take it seriously, and they truly don't believe in these procedures. To say that a labiaplasty is only a psychological procedure was really a very strong statement.
In some, particularly in Europe, they will have a cutoff length. If the labia are shorter than, depending on the place, 4 centimeters or 5 centimeters, then labiaplasty will not be approved. But rather than send patients to the private world for labiaplasty, they are sent for psychotherapy. So there is and one Australian study found that a lot of GPs, when they saw women for labiaplasty consultation, half of them recommended psychotherapy, and yet 75% of the GPs admitted that they knew very little about the procedure. So I think just education about the procedure will go a long way towards greater acceptability.
And I think the internet has helped us in that way. It has really helped with patients communicating amongst themselves and real self and people. I mean, how many times a day do you have people coming in and go, I had no idea that this procedure existed. It's always bothered me. So I think it's helping them, because obviously they can't turn to their gynecologist or most gynecologists to ask these questions. I mean, I think the gynecologist, basically, they're seeing, doing 20 pelvic exams a day. They kind of all blend into the same shape and size, and they know what's normal and natural, and most people aren't bothered by their labia. So then, when someone comes in and says it's bothersome, I think it confuses them. And I also think it's an older generation of, probably not being sexist, but some male gynecologists that are in the mix. And there's some female ones that are also very adamant against the procedure, but they just need to kind of understand the data and be a little bit more accepting.
Yeah, there was one study that actually showed that gynecologists are oppose labiaplasty more than plastic surgeons, no surprise, but women in both specialties are greater opponents than the men are.
Yep, it's interesting.
Yeah, and again, I want to remind anybody, if anybody has any questions, please press raise hand, or you can type it in the group chat. So you've already kind of touched base on it, and I know it wasn't the purpose of the article, but again, the labiaplasty awareness is baffling to me, and your ad hoc studies and questions to your patients, if you had to pick the one avenue that they're finding out about labiaplasties just being an option, what would that one modality be?
Well, Christine already hit upon it with the internet, and that is my suspicion as the greatest reason that labiaplasty is going up in numbers, because 2011, the internet was less sophisticated than it is now. And through the years, you can just see greater awareness, because when I'd done labiaplasty before, and I've been doing this for a number of years, it was really difficult for women to even find out about labiaplasty. They might hear about it, but even knowing what it looked like was sort of a mystery. I had one patient who said the only thing on the internet was gender confirmation, transgender surgery. She could not find any labiaplasty pictures online. And so I think that the internet is probably because that's what's accessible. That's probably really helped the numbers grow just due to the greater awareness.
I think that Google has many, there's a question and answer. So you could type in anything you want to Google, like what do normal labia look like? And now you can get an answer, and then it has a link and you can go to that. And we've had patients that were previous breast augmentation patients who come in and say, I had no idea you did this. I plugged into the internet, and then the next thing I know is I'm on your website, and I'm like, well, I had my breast done by these people. So then they come in to talk about the labia. So I think that the internet is our best ally in not promoting, but just disseminating the information that women need.
How about patients that you don't operate? What would you say are some red flags you have about patients? Because some patients may have psychological issues like any other plastic surgery patient. So are you carefully screening those, or certain questions or personality types you're looking at?
Yes, with the labiaplasty patients, we have seen very few that we feel are not good candidates, but there are a few. And one red flag is when the genitalia look like there's not much really to address, and they're pointing out millimeters and how they want the little details corrected. And so those people we won't operate on.
Yeah, it's like any procedure that we do has expectations, and you have to pick the patients. And yes, we've had people come in and say, I want you to take 3 millimeters from the left, 1 millimeter from the posterior and anterior, and you just know you're in from, just like many other procedures where we say we just can't meet your expectations, and off they go because they will never be happy.
Yeah, some of my criteria are the same way. Sometimes when they come in with a partner, so it's kind of rare to come with a partner to a labiaplasty, but when the partner has a lot of influence, is in showing pictures on the phone or putting, thoughts into the woman's head, that's kind of one of my red flags. And also not having enough labial tissue, or coming in and saying, oh, I heard you do the wedge technique, I want the wedge and you're gonna do the edge. They try to tell you what to do, kind of like people do sometimes with fillers. So those are some of my red flags that I use. But it's difficult because they want to have the surgery, and you have to sometimes, just like you guys just said, you don't think I can meet our expectations, I don't think I meet your aesthetic goals.
I think women
safe.
are the ones that need to request it, and we've had that in not only labiaplasty but other procedures, when the partner, as you said, comes in and the husband or the boyfriend says, well, the way we want them is, and it's like, hold on, what do you mean we want them? You're not being part of this. I mean, you're not having this procedure, and I don't think your wife or girlfriend's going to have it, given the way we're doing it now. So.
How about screening for sexual dysfunction? Do you have that in one of your questionnaires when a patient comes in inquiring about the surgery? Do you talk about sexual functioning and issues at all?
We do, but more with vaginoplasty, because for the most part, most of our labiaplasty patients have other issues that are, it's not primarily sexual function, whereas vaginoplasty, perineoplasty, that tends to be more sexual function driven.
We have them fill out an FSFI questionnaire, all the vaginoplasty and perineoplasty. We have the labiaplasties fill out a questionnaire, but it's not that about sexual function.
Okay. Yeah, I like to just establish that, they don't have dyspareunia, because you never want to be in a situation where now they have dyspareunia. So sometimes I like to, sexually active, do you have any problems? If they usually describe, like you guys said, about infolding of the labia, and that will get better. But sometimes I always think it's important to establish the baseline.
Yes, we do ask about that. Yeah, so it's not as in depth as FSFI.
Good. Perfect.
But that's a very good consideration.
So what do you think in the future? What do you think how should we move this along to convince, the world that this is a good procedure for people? What do you think our next step might be?
Well, I think, establishing validated surveys is a good step. Getting bigger numbers, bigger groups, multi-center studies. I think we need more of those. There are few, but I think we just need to build the body of evidence.
True. Very true. Because I think
And
more
I
and more,
think
like, we know.
collaboration with gynecologists is important because even some of the gynecologists who perform these procedures are ostracized even within their society. So I think if we can cross-pollinate and either publish or do research with gynecologists, it'll lend more credence as opposed to that email that we got from an OBGYN saying that all we're doing is lining our pockets.
That's crazy.
Yeah, some of the cosmetic gynecologists have been terrific contributors.
Yes. Yep. And I try to go to some meetings, some of the meetings that are with the cosmetic gynecologist, because you learn something from them all the time, especially in a lot of those vaginoplasty, perineoplasties that we're not taught in residency. It's always good to join with them and learn, speak at those meetings.
Absolutely. Yeah. Well, you're a great contributor in that arena
too,
too.
Heather. This is a great paper. It was really good. Really good.
It certainly was. And I hate to cut us off. We're 32 minutes into it, everyone. And thank you to Dr. Furnas and Canales for such a wonderful study. Like you said, this is the beginning of many. Again, we appreciate your time tonight. And Dr. Christine Hamori, thank you very much for moderating.
Welcome.
If anyone would like to review this later, again, it's recorded on Radar. And I just want to kindly put out a reminder that every month we have this live journal club. So please keep a lookout in your email inbox, and hope to see you all soon. And with that, we will adjourn and wish everyone a wonderful night and a wonderful holiday season.
Thank you.
Thank you.
Thank
Bye.
you.
Thank
you
you.
again.
See you guys.
Bye-bye.
Good night.
Good
Bye-bye.
night.